Hello and welcome. Today, we're diving into a common yet often misunderstood condition, benign paroxysmal positional vertigo, or BPPV. While it might sound intimidating, understanding BPPV can help you recognize its symptoms and seek appropriate treatment, ultimately improving your quality of life. So, what causes this sensation of spinning? BPPV is usually triggered by a mechanical problem in the inner ear. Specifically, it occurs when tiny calcium carbonate crystals, called otoconia or ear rocks, become dislodged from their normal location in the utricle and saccule structures responsible for sensing linear acceleration and gravity. These crystals then migrate into one or more of the semicircular canals, which are responsible for detecting rotational movements of the head. Common causes include head trauma, inner ear infections, aging, or even prolonged bed rest. Sometimes, the cause remains unknown. Let's delve into how it works. When the head moves, these displaced crystals roll around within the semicircular canals. This movement stimulates the nerve endings in the canal, sending false signals to the brain that the head is rotating, even when it isn't. This mismatch between what your eyes, muscles, and inner ear are telling your brain is what causes the intense feeling of vertigo. Specifically, the posterior semicircular canal is most commonly affected, followed by the horizontal and anterior canals. BPPV is a fairly common condition, affecting people of all ages, but it's most frequently diagnosed in individuals over the age of 50. While specific numbers can vary across studies, it's estimated that BPPV affects millions of people worldwide each year. It's one of the most frequent causes of vertigo, highlighting the importance of understanding this condition. The hallmark symptom of BPPV is a sudden, intense sensation of spinning or vertigo. This vertigo is typically triggered by specific head movements, such as rolling over in bed, tilting your head up or down, or getting out of bed. Other symptoms can include dizziness, lightheadedness, a loss of balance, nausea, and even vomiting. Nystagmus, which is involuntary rapid eye movements, is also commonly observed during an episode. The symptoms are usually brief, lasting from a few seconds to a minute or two, but can be quite debilitating while they last. Diagnosing BPPV involves a thorough medical history and physical examination. The Dix-Hallpike maneuver is a key diagnostic test. This involves quickly moving the patient from a sitting position to lying down with the head turned to one side. If BPV is present, this maneuver will often trigger vertigo and nystagmus. The direction and pattern of the nystagmus help determine which semicircular canal is affected. Other tests, such as balance assessments and neurological evaluations, may be performed to rule out other potential causes of vertigo. BPV is primarily classified based on which semicircular canal is affected. The most common type is posterior canal BPV, followed by horizontal canal BPPV, and less frequently anterior canal BPPV. Each canal involvement elicits different patterns of nystagmus during diagnostic testing, guiding the appropriate treatment maneuver. Fortunately, BPPV is often easily treated with a series of head maneuvers, such as the Epley maneuver, Semont maneuver, or Guffani maneuver. These maneuvers are designed to reposition the displaced crystals back into the utricle, where they no longer cause symptoms. These maneuvers are typically performed by a physical therapist or healthcare professional. In some cases, medication may be prescribed to help manage nausea and vomiting associated with the vertigo, but they do not address the underlying cause. It's important to follow the specific instructions provided by your healthcare provider after the treatment. While there's no guaranteed way to prevent BPPV, certain precautions may help reduce your risk, particularly if you've experienced it before. Avoid head trauma whenever possible. Address any underlying inner ear conditions promptly. After successful treatment, some healthcare providers recommend sleeping with your head elevated for a few nights to help prevent the crystals from shifting again. Gentle head exercises may also be suggested. The prognosis for BPPV is generally excellent. The majority of people experience significant relief after just 1 or 2 treatment sessions. However, recurrence is possible, so it's important to be aware of the symptoms and seek treatment promptly if they return. Research continues to explore the long-term outcomes of BPPV and strategies to further reduce recurrence rates. Some studies are investigating the role of vitamin D deficiency in BPV, suggesting that supplementation may be beneficial. Remember to consult with your doctor for personalized advice and treatment.